Hi everyone, welcome to my YouTube channel. I'm Dr. Samin. Here I share simple and educational videos about sexual and reproductive health to help you learn more about your body. If you want to improve your knowledge, stay with me until the end of the videos. Don't forget to subscribe, like, and leave a comment to support my channel. Let's learn together. Most people think the hymen completely covers the vaginal opening, but that's actually not true. In fact, some people are born without a hymen, and hymens can look very different from one person to another. So let's talk about what the hymen is and clear up some common myths. The hymen is a thin piece of tissue located at the entrance of the vagina. It doesn't completely cover the vaginal opening because menstrual blood needs a way to leave the body. That's why most hymens naturally have an opening. However, the size and shape of that opening can vary a lot between individuals. Interestingly, some people are born without a hymen at all, while others may have a hymen with an unusual shape. In rare cases, the hymen may be completely closed. This is usually noticed at birth or during the teenager years. When puberty begins, menstrual blood cannot flow out properly, which can cause symptoms such as abdominal pain, back pain, and pelvic discomfort. In these cases, a minor surgical procedure called a hymenectomy may be needed. Another type is a hymen with a very small opening, but the opening may be too small for comfortable tampon use. In some cases, a minor procedure may be recommended, and these individuals should consult a gynecologist for evaluation. The third type is the annular hymen or ring-shaped hymen. In this type, the hymen forms a ring around the vaginal opening. The fourth type is the elastic hymen. This type may stretch during sexual intercourse without tearing. Even if it does tear, it's often minimal and may not cause any bleeding. Another type is the septate hymen. In this case, a thin band of tissue runs across the vaginal opening, creating two smaller openings instead of one. The sixth type is the cribriform hymen, sometimes called a perforated or sieve-like hymen. This type covers most of the vaginal opening but contains several small holes. Another variation is a thick hymen. In some people, the hymen tissue is thicker than usual, making it less likely to tear easily. Because of this, their first sexual experience may be more uncomfortable or painful. Now, what are the signs of hymenal injury or tearing? Before we talk about that, it's important to know what hymenal changes can happen for different reasons. They may occur during sexual intercourse, tampon use, pelvic examination, pap smear, insertion of menstrual cups, or other vaginal procedures. Possible signs can include light spotting, mild bleeding, vaginal discomfort, or pain, and sometimes small changes in the appearance of the tissue around the vaginal opening. And that's it for today's video. Thank you so much for watching all the way to the end. I hope you found this information helpful. If you enjoyed this video, please consider subscribing to support the channel. Don't forget to like the video and leave your question in comments below. I do my best to read and answer as many as I can. Thanks again for being here. Take care, and I'll see you in the next video.